Earlier today, I spoke with the director of the Centers for Disease Control and Prevention, Dr. Robert Redfield, who had a dire warning this week about what the fall season could bring. We talked about recent cases where kids have gone back to school and classes reopen, only to have those kids end up in quarantine just days later. I asked him what message that sends to other schools still on the fence about what to do.
Well, I think the most important thing, Lester, is to realize that schools they're not only central to the child's academic success, but they really are important to provide the mental, nutritional, emotional support to children and their families. And this is why we believe it's in the public health interest of K-12s to get back to school. The most important thing to impact what you just said about kids being found to be COVID positive in school is to continue to get control of the transmission within the community. Again, many of these children obviously got infected in the community setting. So this is going to be one of the challenges, to make sure we continue to make progress on community transmission in the communities that open, and to really look, it's in the best interest of our society to work towards face-to-face learning.
And in schools, in communities that are still wrestling with an outbreak, should they be feeling pressure from the CDC and the White House right now to open classrooms, or do you give them the space to make that decision?
Yeah, we don't want to pressure anybody. Our guidance is there to help them begin to open, as I said, safely and sensibly. The timing of that is going to have to be decided one school at a time. We're there to help provide that technical assistance.
You, I think, alarmed a lot of people with your assessment of what the fall could bring. We've got the flu season coming up here very soon. You and I both know that even without COVID, schools can be petri dishes sometimes. Walk me through what we might expect, not only in schools, but elsewhere.
You know, thank you, Lester. I think it's really important, the emphasis that I'm trying to make, that I personally believe that the American public is taking heed to the messages that we said, of the powerful weapons we have: universal face mask, distancing, washing hands, and being smart about crowds. And we do that we're going to have a significant impact on COVID, and we're going to have a significant impact on flu. But I want the parents to realize this is time to embrace the flu vaccine with confidence. Normally, only about 50% of the American public take advantage of the flu vaccine. That if we choose not to get vaccinated, not to embrace these mitigation strategies, it could be a very difficult time. But I don't believe that's what's going to happen. I believe the American people are going to embrace these strategies, and as a consequence, and get vaccinated for flu, and we're going to get through, united, this pandemic and flu season together. And I'm optimistic, cautiously, that sometime in the late fall, early winter, we'll have an additional help, which will be the beginning of having a safe and efficacious COVID-19 vaccine that we can begin to apply to help counter this pandemic.
Well, you have seen probably the same pictures that we have been sharing every weekend, it seems. We end up with these pictures of mass gatherings, people not wearing masks, ignoring those rules. If that continues, flip this upside down. What are we looking at?
Well, what I'd like to do is see how we can get the counter story out there, too, where we do see universal mask. I think that's why I said it was a tale of two cities, you know, between whether we have two pandemics occurring at the same time or whether we're able to use these tools to mitigate them. I'm still going to stay and put my confidence with the American public that they're going to embrace flu vaccine. They're going to embrace these mitigation steps. We are seeing a change in the number of jurisdictions now that have an upward trajectory.
And as you know, parents right now, they just really want some guidance. They want somebody, an authority with the knowledge to say, it's okay to send your child back, it's going to be okay, or maybe it's not. What do you say to folks watching right now who really need to hear from you or someone like you?
Well, I think it's an important thing. We have tried to put out checklists for parents, as you know, that we've recently put out to help them make that decision. We are going to be putting out additional reference material to help based on the amount of transmission in different areas. I think it's important for people to realize this is a process. Not everybody has to run at the same pace. We have to rebuild the confidence, obviously, of students, parents, and teachers. Clearly, those areas that are having limited transmission, what we call the green zones, are great places to start. Obviously, in red zones, one has to be more cautious. But I don't want to pontificate that, yes, you have to open if you're green, and no, you can't open with your red. I think we have to take each of these situations and evaluate them for their unique circumstances.
You made the pitch, of course, for a flu vaccine. The anti-vaccine movement is alive and well in this country, and they've come at odds with schools over requirements. Are you worried about an acceptance of a vaccine in schools?
Yes, and this is why I really call on my colleagues. I'm a physician by training. I call on physicians, nurse practitioners, PAs, nurses, the medical community to invest the time. It doesn't help to ridicule a parent that's nervous about vaccines. We're all nervous about making a mistake for the health of our children or grandchildren. And take time to work with those individuals so that they can understand whether they should be nervous if they're leaving this vaccine on the shelf. They want their grandchildren and their children to benefit from it. The same for the people that have been misinformed. There's a lot of people that have misinformed. You can't change their view by just telling them, you need to change your view. I don't agree with you. No, it's going to take time and dialogue to move individuals from what I call vaccine hesitancy, from either fear or misinformation, to bring them into what I'm trying to coin vaccine with confidence. I need basically my medical community to go all in on this, and I need those individuals that understand the value of this important, most powerful scientific gift to modern medicine, vaccination, to embrace that vaccine. Don't leave it on the shelf for their children, themselves, their community, and their family.
All right. Well, Dr. Redfield, we appreciate you taking some time. It's always good to speak to you, and we appreciate the update. Hopefully we can do it again at some point.
Right. I hope so. Thank you very much. God bless you.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.